Guess what, guys? It's me behind the camera today. You don't have to see my face. This is Buffy, the MRSMD. We are here today with Dr. David Purcell, the actual MD, and our fabulous patient and my good friend Alicia Hamilton, talking today about the lymphedema protocol. Dr. Purcell, tell us a little bit about your company and the lipedema protocol.
Well, I'm Dr. David Purcell, and I am the Chief Medical Officer for MRSMD. And it's not my company, it's my beautiful wife's company. I just work for her. So we have a weight loss company where we we help with a number of different ways to get people's weight down. Diet, exercise, we can incorporate cognitive behavioral therapy, other behavioral modification, GLP-1 medications, other medications as necessary, as well as TMS or transcranial magnetic stimulation.
So what is transmagnetic, whatever you said?
TMS or transcranial magnetic stimulation. This is using electromagnets to stimulate various areas of the brain depending on what we're treating. So for weight loss, the areas of the brain that we're treating are they're called the insular cortex on the sides of the head here, and then the prefrontal cortex in the front here. And we know that these areas can, by stimulating them, what we can do is we can help reduce food cravings, and we can also help with food choices. And what the data is showing is that people who get TMS, in addition to diet and exercise alone, are losing about 17 pounds more than just the diet and exercise. So it can be a very effective treatment to help with weight loss.
Okay. Mrs. Hamilton, tell us a little bit about yourself and your business.
Okay, well, I am a lipedema advocate expert. So what I do is I help women, mostly women, that have lymphedema that have not actually been diagnosed yet, and they're still trying to figure it out because a lot of doctors right now do not know a lot about lymphedema. And so what my company, Champions of Change, do, we kind of get them to the right people. And what I've learned in taking the GLP-1, it helps with the volume, which is the size of the legs or the size of the arms, to bring it down. And it also, the biggest thing is with the pain. So this wonderful doctor here came aboard with Champions of Change to help women get this product, what they need to help get the volume down and the pain.
What is lymphedema?
So lipedema is an adipose tissue disease. So adipose tissue is the fat tissue, the fat cells that store fat. Everybody has adipose tissue. It's something that's necessary, but sometimes when we develop obesity, we can have too much adipose tissue in various areas. Lipedema is a little bit different though. The adipose tissue is affected by inflammation, by lymph fluid, which comes out of the arteries and out of the veins. And what this can do is change the fat in the way that it actually functions. And it makes it much more difficult to treat. And so the way we look at lipedema is it's accumulations of fat that can occur, usually it's the lower extremities, it can also occur in the arms. It's usually symmetrical, means it's the same on both sides. So it's not like you're going to have a lot more on one side than the other. And it can also be painful, particularly as it gets more advanced in the stage of it. When you look at lipedema, it actually feels kind of weird. So early stages, when you run your hands over it, it might feel smooth, but as it progresses, it can begin to feel lumpy. So in the stage 2, it can feel kind of granular, like there's some gravel or pearls under the skin when you run your hands over it. And then as it gets more advanced, it gets into stage 3, then you can feel more like nodules or lumps. Now these lumps, these nodules can also be painful. And so it's not just obesity and accumulation of fat. It is something that can be very painful and difficult to live with.
Absolutely. And I think a lot of times doctors have confused obesity with lymphedema, and it's not necessarily just obesity.
Absolutely. In fact, you can have lipedema without having obesity.
Absolutely.
Per se.
Absolutely.
Although it is oftentimes confused for that.
Okay, since you explained the difference from lymphedema and obesity, is there a difference with lymphedema?
So lymphedema is a little bit different. So technically, lipedema is a subclass of lymphedema, but lymphedema is a disorder of the lymphatic system. So that's what helps drain all the lymph that comes out of the veins, and then that's taken back up into the lymphatic system and returned back and put back into the circulation system. So when your lymphatics aren't working like they should, you can get an accumulation of lymph, and that can result in lymphedema,
Right.
which is swelling in the tissue and inflammation. But it's not necessarily a problem with the adipose tissue or the fat tissue per se.
Right. And lymphedema, I think, is you could say it more like it's a clogged up sewage that it kind of
Exactly.
stays there. So if you're not getting the proper care for it, which a lot of people now, they have to use the lymphedema machine, the lymphatic drainage machine. So that kind of helps get it moving. So there's a lot of different things that you can do to get it moving. But if you don't know those things, you'll wind up with almost elephantitis.
Yeah, absolutely. Elephantitis is essentially lymphedema.
Yes.
Mrs. Hamilton, is this mostly found in women?
It is mostly found in women.
Yeah, it is predominantly in women. It's rare in males. There is some genetic component to it. There's about a 60% genetic vulnerability. So if you have a family member with it, you have about a 60% chance of getting it as well.
Right. And what I've learned from, helping a lot of people or a lot of patients is that the lympha and the lipedema is, you can get it secondary. And what I found out, a lot of women that go for like tummy tucks or get a lot of lipo, they end up with the edema. And so if you're not getting the proper care or get the proper diagnosis, then it just continues to get bigger.
Okay. How does semaglutide work?
So semaglutide and other GLP-1 medications, the way that they work are they activate the receptor of the GLP-1 or glucagon-like peptide 1. This is a normal hormone that's released by your intestine after you've eaten a meal, and it does a number of different things. So it reduces glucagon, which is a hormone that tells your liver to produce glucose. That's usually produced when you're hungry. So when you eat something, the GLP-1 is released, and the glucagon levels go down. It also causes an increase in insulin levels. So this causes the glucose that's in your bloodstream to go into the cells where it can then be burned. So these GLP-1 receptor agonists, they mimic the GLP-1. In fact, they stick around longer than GLP-1, so it helps you feel fuller longer than the actual hormone. It does this by the hormone changing the glucagon and changing the insulin that I just described. It also slows the food passing through your gut, so you feel fuller longer. The other thing that it can do is GLP-1 goes into your brain and tells your brain that you're not hungry as well. And so with these GLP-1 receptor agonists, it can do all these different methods of really helping to reduce appetite and help folks with losing weight.
Back to lipedema, how do you get it? Is it hereditary? Can you get it because you're morbidly obese? What are the ways that you get lipedema?
So
both of you.
So the exact mechanism isn't fully understood, although there are a number of different causes that we feel like contribute. One can be genetics. Something else that can happen is I mentioned the lymph, and if your lymphatics aren't draining the lymph as well, the lymph accumulates. And what it does is it actually changes the adipose tissue into more of a lipedema tissue. Their trauma can result in lipedema. And so there really are a number of causes that can result in lipedema.
That is absolutely true. And that's actually how I found out that I had lipedema and lymphedema is from trauma, from a surgery. So I found out that I first had lymphedema, and then because of the accumulation, I also ended up with lipedema. And my daughter also found out that she had lipedema from trauma from jumping out of airplanes in the military. So there are so many different ways that you could get it, have it, and not know it.
And a lot of people think that you get it just because you're overweight. They watch shows like My 600-Pound Life and they think it's correlated solely to obesity, and that's not true.
Absolutely
Yeah,
not.
that's absolutely the case. You know, oftentimes it starts in puberty, but it's usually not diagnosed until much later in life. Sometimes not even until menopause. And so women can really suffer with this for a long time
Yes.
before getting it recognized and actually getting some treatment that may be helpful.
Right. And the sad thing, again, like I said, a lot of doctors are not educated on it, and a lot of patients go years complaining about it, and they're just told that they're obese, and that's not true.
Yeah, absolutely, because the lipedema is not going to respond to things that obesity will respond to.
Absolutely. And I think that's what I found out in taking the GLP-1 is that even the hardest weight to lose in someone with lymphedema, when you take the GLP-1, that stubborn fat that's been there is the first thing that you'll see go.
So how does semaglutide help individuals with lymphedema?
So semaglutide and other GLP-1 receptor agonists, what they can do is first, by losing weight, you can help take pressure off the lymphatic system, so the lymphatic system actually drains better. The other thing that it does is it just can reduce the mass, the fat mass, the mass of adipose tissue. And so that also can help to some extent. And then it also reduces inflammation, because inflammation is a big part of lipedema as well.
And a big part of the pain from the inflammation.
Absolutely.
So the GLP-1 has been godsend for patients with lymphedema and lipedema.
What are some other things that patients can do, specifically since you live with this and it impacts your life, and you have a foundation that you're very passionate about educating people about? You had told me about a brush. So can you kind of tell people a little bit about the homegrown kind of remedies also that kind of help with the pain and the symptoms and everything?
Okay, there are several, what do you call it, remedies that I do. One is leaning with your legs against the wall, which helps kind of bring down some of the inflammation in the legs. It sounds really crazy, but it works. I spend 5 minutes with my legs up against the wall. And then the second thing is dry brushing. You have to dry brush every single day because it helps get the lymphatic system moving.
What's dry brushing for the people like me that don't know what that is?
Well, it's let's see how to explain. I have one. Okay, so these are the dry brushes, and of course you have to brush your body when it's dry. So you don't do it, like after the shower or anything. So you do it before you wet your body. So what I do, and this is what has worked for me, is when using the dry brush, I actually take it and I form my skin how I want it to look. So if you have sagging skin, this actually does work. It is a daily process, but you just take it and you brush it in the direction that you have the loose skin hanging. So if it's hanging here, of course you want to keep brushing it in that area. The more that you do it, the more that your skin will become soft again, get away all the bumps. Dry brushing absolutely 100% helps with cellulite. But like I said, you have to do it daily. And also I take the rolling pins here and I do the same thing, and you roll it to get rid of the cellulite. But you do those two things every single day, you will notice a huge difference.
After you do it, do you put some kind of oil on it?
I absolutely do put oil on it, and I have that coming. So
okay.
I'll let you know more about that once it's here.
Okay.
But there is a certain oil that you have to put on afterwards.
Okay, so we're going to stay tuned for your organization.
So that was 1 and 2. You had a third item.
Thank you.
And the third, thank you so much. And the third item, of course, is the vibration plate.
Oh, yeah.
So that helps tremendously with people with lipedema. So you do that about 10 minutes per day, and you'll notice a difference in how heavy your legs feel. So that's the purpose of getting on the vibration plate. So it kind of gets your lymphatic system moving and, keeps you from being so sluggish.
And that's coming soon as well.
Absolutely.
Okay, fantastic.
Now, one other thing that I will say is diet actually is very important. It's not going to reverse the lipedema, but if you have the right diet, and what I mean by this is get those carbs out.
Absolutely.
You've got to get rid of the carbs. And what that can do is help slow the progression of the lipedema.
Absolutely, 100% correct. You know a lot about this. But it does help. So what I do is I eliminate the carbs. I have one cheat day, so that could be Saturday, but 6 other days I do not eat any carbs because that does make the lipedema grow.
And I've been around her, she telling the truth. Because I be like, girl, what can you eat?
So, Ms. Hamilton, what traditional treatments have you tried before semaglutide?
Just regular diet and exercise, of course, the vibration plate, the rebounder, which is an in-home trampoline, and the dry brushing, and eating correct.
What changes have you noticed in your body and self-confidence?
Oh, honey, I really want to walk around in a bathing suit. The GLP-1 definitely changed my life, especially if nothing else. If you don't do it for the weight loss, do it for the pain relief, because it takes away the pain, it takes away the heaviness, and the volume size. That is the biggest takeaway of taking the GLP-1.
Have you experienced any side effects from semaglutide?
I personally have not. I do have a few friends that said they have some sickness. They feel nauseated, but once they're, taking it for a couple of weeks, they don't have that much. And then there are other things that you can tell them that.
Yeah, absolutely. So the common side effects from medications like semaglutide, nausea and vomiting, do tend to be some of the more common ones, although it doesn't happen in most people. Diarrhea, constipation, sometimes some reflux or indigestion. But generally the side effects are all GI related. They tend to be mild. They also tend to be short-lived. And so, if you get them, there are some things you can do, particularly for nausea. Ginger can be helpful. Peppermint can be helpful. If you need something a little stronger, if the nausea is more unmanageable, you can talk to your doctor who's prescribing the semaglutide, and they can give you a nausea medication as well.
Well, let me ask you a question, because I have some friends that said that they are real tired. Do you recommend taking a B12 supplement also with it?
So generally what I recommend is for vitamin supplements, a vitamin B complex can be helpful. A vitamin D with calcium is also very important, and just a general multivitamin.
Okay.
But also with the fatigue, you want to make sure that make sure you're getting plenty of fluids in. You got to stay hydrated. And then also you got to make sure you're eating enough calories, because a lot of people have a tendency to not want to eat anything.
I know it does, but I think that's the hardest thing for me. And I think Buffy is the one that taught me about making sure I'm getting enough protein.
Absolutely, the protein is essential.
And I think Buffy has a new protein shake that's coming out or something.
Absolutely. So we're going to be coming out with a line of protein bars that are going to have fiber in them as well, and also protein shots. Both the bars and the shots are going to have.
This is so exciting.
Yeah, they're going to have 15 grams of protein in them. The shots actually, the only calories in that are from the protein. There's no sugar, and it's a little 3 ounce. Get 15 grams of protein in very easily.
Oh, so it's not an injection shot.
It's a shot.
Oh,
I call it a shot, like you're drinking liquor, like it's a shot. You just get your protein in.
Well, I need to try one of those today.
Oh, okay. I got y'all something to take home.
Okay, awesome.
So I know you said some people feel that they may not get enough calories. For the ones that may not be hungry, how do you suggest they get their calories or protein in?
So you definitely want to try to get the bulk of your calories in from protein, because that'll help also with your protein needs. So if you really feel like you can't eat very much, protein shakes, protein bars, those things can be very helpful. Try and eat things that are high in protein. So me personally, I like beef jerky. It's a great snack to have on hand. No carbs in it. And there's lots of protein. Nuts are good. Cheese also have lots of protein. Yogurt, although you got to be careful with yogurt, because a lot of yogurt has a lot of sugar in it.
Oh my goodness.
And so you do have to watch out for your yogurt.
Yeah, he makes me do the diet Chobani.
Chobani. Okay, so is that one low in sugar?
Either the low sugar or the zero sugar are low in sugar. Otherwise, the Chobanis do have a fair amount of sugar in them, but they have lots of protein. Any of the Greek yogurt can have lots of protein.
How do you make yourself eat, though? I think that was our question. So, not what to eat, but how do you when literally the shot makes you feel GLP-1 semaglutide makes you like forget to eat. How do you remind yourself to eat? What are some tips and tricks for that?
Yeah, so smaller meals kind of throughout the day are going to be important. Keep something visible so it kind of reminds you to eat. If you have to set an alarm on your phone reminding you to get a snack or eat a meal, that can also be something that can help.
Because I know what I do is we grill up, like a lot of chicken and steak, so we have it readily available.
So you meal prep.
Yes.
Smart.
Yeah.
Meal prep is very important because if you are kind of on the go and you need to grab something quickly, if you don't have something readily available, what are you going to get? You're going to get the bag of chips out of the vending machine. You're going to run through the drive-through at McDonald's, and it's
well, I'll
terrible.
tell you what, I do not do that because I'm afraid to do that. So even if I go through McDonald's, I will just get a burger with no bread, and they put lettuce on each side.
Or get the salad.
Yeah. Well, I don't like McDonald's salad. Sorry, McDonald's. But
They ain't paying us.
I prefer to just have a nude Big Mac with lettuce
absolutely.
on
Just
both sides.
take rid of the bread.
Yeah.
Get rid of that bread. And no fries. And no apple pies. And no sodas with sugar.
Buffy, you're not eating that anyway. You're a 2.
Don't tell people what my size is, honey. I'm not 2. I'm a 4. You a 2, honey. Lies. You tell this day.
What are the long-term effects of semaglutide on individuals with lymphedema?
So, lipedema with semaglutide, what it can do is it can help reduce the mass of the adipose tissue in the lipedema. It can reduce the inflammation, which can help prevent accumulation of lipedema tissue, and it can also reduce the pain. And so I think it's a great medication to use, and it's something that we just haven't had treatment for before now.
A lot of Facebook groups, and also with your organization, and the name of your organization again is?
Champions of Change.
Champions of Change. And you're advocating for people with lipedema and living with it, and also telling them about how semaglutide can improve their life. What is their big challenge?
Well, not just semaglutide, it's any of the GLP-1.
Okay.
I think it has helped tremendously, and I think the biggest problem or issue that a lot of people are saying is getting it from a great company, that it's not watered down. I think with MRSMD, it has been perfect because it's not watered down. It works right away for people with lipedema. Now, I can't speak for just weight loss. I'm speaking solely on lipedema and lymphedema. What I've noticed in people that I've sent to you all that have tried it is they see a huge difference in the volume size of their legs or their arms, wherever they carry the lipedema at, and the pain has completely gone.
And so what is your advice for patients looking for GLP-1 to help with lipedema in this environment now where the FDA has taken tirzepatide off the drug shortage list? Is semaglutide enough, or does it need to be tirzepatide or some other GLP-1? Dr. Purcell.
No, semaglutide is a medication that can be perfectly fine for treating lipedema. And while the others also work, like tirzepatide, that one is now much more difficult to get. You have to have insurance that would cover the brand name, and you would also have to have an illness that your insurance company would approve, unless you want to pay a lot of money out of pocket to get the brand name. So that's where the compounded formulations actually are nice. However, since the FDA has taken tirzepatide off of the drug shortage list, the compounding pharmacies can no longer produce that. But semaglutide is still available as a compounded formulation.
And the FDA recently took a second look at this decision.
They're reconsidering that. We don't know what will happen, but hopefully we'll have a decision soon as to whether they're going to put it back on the drug shortage list or not.
So the MRSMD from behind the screens will tell y'all the T. The T is, ain't no way in the world Eli Lilly is going to be able to keep, in my humble opinion, is going to be able to keep up with the demand for tirzepatide, Mounjaro, and Zepbound. And so when the FDA sees that people are still having difficulties accessing these medications, they're going to put it back on the shortage list, and they will be prescribing it again at MRSMD.
That's what we're hoping.
That's what's going to happen.
And we're also hoping that some way that lipedema will be approved for a need of that medication, and not where it's paid for out of pocket.
And that's something that Dr. Purcell is going to work on with his clinical research company, Advanced Discovery Clinical Research, right, Dr. Purcell?
Yes. Advanced Discovery Research, we do a number of different clinical trials. And so looking at medications like the GLP-1s to see how they would work for lipedema or lipedema, this is something that would be right in our wheelhouse.
Okay, you both talked about changing your eating habits and dieting. Is there any other recommendation for patients on semaglutide as a lifestyle change?
So the diet really is the most important thing when it comes to weight loss along with these medications. You've got to have the right diet. Generally, what I'm going to recommend is a low carb, high protein diet because that is actually one of the diets that has really been shown to promote good weight loss. Others, if there's a reason you can't do a low carb, high protein diet, if you have renal failure or things like that where you have to limit the amount of protein that you take in, low fat diets can be effective, calorie deficit diets can be effective, and the Mediterranean diet can also be effective for weight loss.
Mrs. Hamilton, tell us what do you eat in a day?
I eat very low carb, high protein, and a lot of water. So you have to make sure that you're getting enough water intake in. It's very important.
So both of you talked about staying away from carbs. Are there any good carbs that you can add in maybe once or twice a week?
Really, the only good carb is fiber. That is technically a carbohydrate, but it's also not something that your body digests and uses as fuel and as calories. I think a large part of our obesity epidemic really has to do with our food supply. And the fact is, fiber has been stripped out of everything with regards to processed foods. It's been taken out. And it's a huge problem because if you have more fiber in your diet, not only does it help you feel fuller, it helps you feel fuller longer. It also reduces the sugar absorption you get from your gut. And it can also help with just general gut health.
And I will like to add also, I know a lot of personal trainers will say that you should add in, good carbs. You need to add, like sweet potatoes and different things like that. I'm only speaking on what it does for lipedema, and it makes my lipedema grow. So I stay away from carbs. You will notice, like when you eat carbs, that the heaviness of your legs, the pain will start to come back. So I personally stay away from it as a lipedema patient, not as just someone trying to lose weight. So it's a really big difference.
And the fiber is important in taking a GLP-1 or semaglutide or tirzepatide because a lot of people have a side effect of constipation.
Absolutely. And so the fiber can be very helpful in reducing that.
And you have protein bars that contain fiber.
We have protein bars that contain fiber as well.
Now, what is your how do you feel about people taking psyllium husk as fiber and for constipation? Do you think that helps?
And yes, that's totally fine. Any type of fiber that you want to do.
Okay.
Now if you're eating a bunch of fruits and vegetables, you're probably getting adequate fiber in your meals,
Mm-hmm.
in your diet. But for folks who aren't eating a whole lot of fruits and vegetables, a fiber supplement really is something you want to do. You could use either a dissolvable fiber supplement. Some examples of that would be like a Metamucil or a Benefiber that
Mm-hmm.
mixes up and dissolves completely in water. But like a psyllium husk and some other ones like that, chia seeds and the like, those are insoluble fibers.
Okay.
They tend to be a little more difficult to drink if you
They
like
are.
mixing
You have to
them.
drink them right
Yeah.
away. But for the people that does get the adequate amount of fruit in, and they still feel like they're constipated with taking the GLP-1,
Mhm.
what do you absolutely recommend for those people?
So stool softeners, Colace or Docusate is the generic for that. If you need something a little more than that, you can look at Senna, which is a natural laxative. And you can get that either as a medication or as a Senna tea. And in fact, they also have medication that's a combination of the Docusate and the Senna called Senna-Cot.
Okay.
So that's just another thing that can help with constipation. If you need something a little bit more than that on occasion, something like a Docalax as a laxative can also be helpful.
Now, how often is it good to take that? Is that something that people normally take every day, you think, or they should not have to?
The stool softener and even Senna is fine for everyday use if you need it.
Okay. Because I get a lot of questions like that. I want to make sure I'm giving people the right information.
Yeah. You don't want to do the Docalax every day, just because
Okay.
that can lead to more gut problems. But the stool softener and the Senna, not a problem.
Okay.
What are the future prospects for treating lymphedema? Are there any emerging treatments or research?
So there is research going on. I think a lot of it right now is focused on these GLP-1 receptor agonists, just because they have been shown to not only promote weight loss, but also reduce the inflammation, which is a very big piece of this. And so I think other treatments may come down the pike that help with the inflammation and help with the adipose tissue function, and we'll see what comes of that.
Right. And until that happens, dry brush, dry brush, dry brush.
Champions of Change.
Absolutely.
So my final question, do you have to work out with semaglutide, and also with lymphedema patients? What do you suggest for working out?
Okay, for me, what I do is I walk every morning. I get up at like 6:30, 7 o'clock. I do about 4 miles a day. That helps me. That's what works for me. Everyone cannot do that, with lymphedema because of, maybe the volume size or the pain that they're going through. But to me, you have to get some type of workout in. It just helps. It helps you.
Exercise is important. Not only is it good for your general health, it can help burn more calories, but strength training, resistance training is something that is really very necessary, because as you're losing weight, you can lose muscle mass in addition to fat mass. And so by working out with weights, with resistance bands, any type of resistance training, that can help promote the building of the muscle and stop the muscle loss.
Yeah, that's what he got on me about. Not just walking.
Yep. Gotta do more than just walk.
My daughter told me that also. Start lifting weights. Well, I'm a baby of pain, so I do not like to lift weights, but I have started to add that in my regime every day.
Good.
The thing that we're going to announce today is the partnership between MRSMD and Champions of Change in what we call the Lipedema protocol. And it is making available our providers to provide monthly services when patients come in for treatment for lipedema using semaglutide. At this time, just semaglutide because of the shortage, unless they go through insurance and use Mounjaro or Wegovy. And then also having the resources with the educational assistance and the encouragement of Champions of Change, and also the dry brushing and the oil and the vibrational plate when it's coming out, and the MRSMD nutrition products for protein. So we're putting all this together, and it will be available on both of our websites for you all to get more information. We'd like everyone who is an MRSMD patient living with lipedema to become a member of Champions of Change organization, so that you can have the support that you need in this very niched, I guess, community,
Yeah.
because a lot of people don't know about it.
Right, they don't. But I also want to just give you your flowers, because you motivated me, because I had lost weight already, but seeing you with your weight loss over 100 pounds was simply amazing, because it seemed like it happened overnight, but you look like a total different person. Your happiness, your glow, all of that is just so beautiful. So even you taking that motivated myself. So I'm just so happy and honored to be a part of this team.
Thank you so much. And thank you for being here. Dr. Purcell, you did a great job. We'll talk to you later with your notes.
Get my critiquing.
We're going to have note cards.
We'll have note cards for y'all for the next time. Because the next time y'all doing a live, so y'all going to have live questions. No, and we thank you so much, Mrs. Hamilton. Please tell us where to find Champions of Change. Also, you're an amazing interior designer. You didn't mention that before. You have products. Please tell us everything. If people want to know where to find you on social media, let's know. Let's go.
Okay, so you can find me on Instagram as well as TikTok. Facebook under Alicia Grandeur. We're still creating the website and all of that for Champions of Change, but if you go on Alicia Grandeur, you'll find that link that will take you straight to Champions of Change.
Child, spell Grandeur for the people.
So it's Alicia, Alicia, Grandeur, Grandeur.
Child, that French stuff. You need
Right. My Georgia education.
You know how to spell that? Dr. Purcell, where can we find you?
mrsmd.com. Would you like me to spell that?
Yep.
mrsmd.com.
And if you can't find him, this is Buffy's husband.
Right. Google that and you will find them. Thank y'all so much. If you all have more questions for us, please reach out to mrsmd.com or you go to Alicia Grandeur, Grandeur. It's Alicia Grandeur. I was just spelling. Y'all know how to spell Alicia. But I'll put it up on the screen anyway. You can DM and we'll let you know when the Champions of Change website is available with all of the information. Until then, feel free to text us at 404-737-1091 and text lipedema and we will put you in contact with Dr. Purcell and Mrs. Hamilton. All right, thank y'all so much. Good job.